API, getting out to patients where they're able to access their medical data, but also getting data back into the system from patients. Next. We will be building this in another hospital. So we'll be connecting in another hospital in Montreal, the Saint-Justine Hospital, which is a pediatric hospital. But this will be our proof of concept of working in a multi-institutional setting with one portal, accessing data from multiple hospitals at the same time. Next. This will then allow us to prove that we can work in a multi-institutional context, which is our ultimate goal going forward. Next. And as part of the SmartCare concept, we will be building in wearable devices. And we've got two companies in Montreal, Vital Tracer and IMD Research, who will be working with us to allow their wearables data from a smartwatch and a smart bracelet to be sent into Opal via Bluetooth and then make it in through Opal's secure technology into the hospital in blue, where it will be accessed by clinicians. Next. Beyond this, we're moving into the world of research, which we have in here in red at the Research Institute of the McGill University Health Center. And our goal here really is to do data sharing under the control of patients, to get e-consent from patients to share their data for research, to do real world evidence research, and to do AI research. Next. And we have a number of industry partners that we're working with as part of this. So we have Roche and Novartis, which are two multinational pharma companies. And then we have MIMS and Imagia, which are two AI companies in the healthcare domain in Montreal. So this really is what the consortium is all about. It's about putting patients at the center of their data, getting new data in the form of wearables and outcomes from patients, bringing them into the clinical world, but also getting them into the research world and working with our industry partners so we can really learn from this. Next. So in summary, the Quebec SmartCare Consortium is about data. Next. It's about technology, their mHealth technology with Opal and our AI partners. Next. It's about our stakeholders, patients, clinicians, researchers, and industry partners. It's about the governance that goes all around this to make sure we're doing it correctly and we're sharing data in the right way. And then finally, it's about an evaluation where at the end of this 3-year project, we will be able to say that this concept works or it doesn't work and what are our recommendations for going forward. So that's my part of the presentation. I'll hand over to Kayla where she will present how she's been working on getting mCODE into this. Thank you.
Okay, so I guess if you control the slides, I'll also say next because I have a lot of animations.
Okay.
Yeah, so as John said, I'll talk about how we've started our prototype of implementing the mCODE radiotherapy profiles into Opal. So next slide. So first, I want to just mention how this mCODE fits into Opal's existing architecture in the hospital, which is shown here. So on the left, we have the medical databases. And then we have a set of database extraction scripts, which takes the data out of the medical databases and puts it into Opal's own database. And this serves a few purposes, one of which is to ensure that the code that runs the app doesn't actually touch the medical databases directly. So then once the patient data is in Opal's database, it can then be sent to the patient on the app to be viewed. So next. So now for adding the mCODE component to this, and this is still in our developer mode. So because mCODE is not actually used at our hospital at the moment, instead I used a FHIR sandbox on the left, which contains sample patient data. And then I created my own mCODE extraction scripts in parallel with our other scripts that would request and extract the mCODE data from the sandbox and then format it and put it into Opal's own database. And then from there, it uses the exact same architecture as the rest of the data in Opal, where it can be sent to the patient app. So this is just to show that it's very flexible to implement, and we can implement it essentially by keeping our same architecture, which is great because often when you're implementing standards, it might have to be an iterative process. So it shows that you can have two things running at once. Yes. So next slide, please. So first, I want to just discuss our radiotherapy menu, which I added to the app last year as my master's project. And the goal here was to give patients access to their radiotherapy plans before undergoing treatment so that they could be better prepared for their treatment. And there's two main interfaces. So there's the one in the middle, and this provides a customized explanation of the treatment plan that is based on the patient's treatment parameters. And if you click next, it should play a video. or not, but anyways, on this slide on the right shows a 3D rendering of the patient's body along with the beans that they will receive during treatment. And so this is completely interactive. So it's so patients can look around on their treatment to understand what's going on with the beans. Next. So this menu uses at the moment DICOM data, which is the typical standard that is usually used for imaging and radiotherapy data. And the idea was that we want to give this to patients before undergoing treatment. So these show the pre-treatment plans. Now, in contrast, the mCODE profiles that we want to implement in Opal show post-treatment summaries. So once the treatment is done. And we thought that this would be a great addition to what we have here because oftentimes this treatment that we give patients here that is planned doesn't actually get delivered exactly according to plan. And so by adding these mCODE post-treatment summaries, it can give sort of the whole picture showing what was planned and then what was actually delivered. Next slide. So now I've modified the radiotherapy menu to account for this additional data. So at the top, we have the pre-treatment plans, which is what I just showed you with the DICOM files. And now I've added a second section at the bottom containing the post-treatment summaries that were the actual delivered plan. And these are the mCODE data. So next. Yes, so then opening up one of these will show essentially a plain text summary of the radiotherapy plan, and it contains all of the elements that are in the radiotherapy course summary profile described by mCODE. And it also includes the radiotherapy volume elements as well. Next. So here's a demo. You might, yeah, I can press play. So this is a demo of what it looks like in the app. So opening up the radiotherapy menu, again, as I said, at the top, you have those pre-treatment plans that would be given to you before going through treatment. And at the bottom, you have the post-treatment mCODE summary. So these would show up after your treatment has been done and finalized. So then opening up this part here will show the overview that I showed you before. So at the top, we have the treatment overview, which shows information like the number of sessions, the reason or diagnosis for treatment, and the body site and dates. And then often during treatment, you might have different phases where the parameters might change a bit. And so all those phases are listed below, and these have a bit more detailed information, such as the modality, the treatment technique, as well as some of the doses delivered to some relevant volumes, which is very useful information to have. And then you can just scroll down and see all of the different phases that are contained, and all of this page would be your overall radiotherapy course summary. So next slide. Oh, thanks. So then I just wanted to finish off with a bit of a discussion about this and the fact that we're using two different standards now in the radiotherapy menu. We have the DICOM and the mCODE. And I really think that there is a place for both of these in the app and that they really complement each other. So the DICOM pre-treatment plans contain lots of details about the treatment. And this is useful for patients to help them understand and prepare for their treatment. In contrast, the mCODE post-treatment summaries provide a very concise and easily retainable summary that patients can easily share around. And so they can either just keep it as a record for themselves or, with mCODE being, meant to be shared around. So we hope that they'll be able to share that either with their clinicians or with researchers. And I think that aligns very well with our goals with Opal and the consortium. And so overall, I really think that the mCODE data and the radiotherapy treatment summaries really contextualize other data and in the bigger picture. And I know here, I'm talking about radiotherapy in general, but if you go to the next slide, the bigger picture is really, all of the mCODE data. So now imagine, for every treatment plan you have, you also know that you have all of this data for the patient. And I think in terms of research, especially, this is really important because it adds lots of value to your data and to your analysis that you're doing. And so that was the implementation of the radiotherapy profiles in Opal, and hopefully we'll be able to implement more profiles as well with time. And so I'll hand it back to John for some closing statements.
That's it, Kayla, thank you very much. And I just wanted to say thanks to Anthony and the team for the opportunity to present, and we would be happy to answer questions. I'm not sure whether they fit in now or later, but whenever we'll be available.
Thank you so much, John and Kayla. I really love this presentation and the demo. So I've asked John and Kayla as any opportunity I get to present the work. So I really appreciate it on the CodeX community practice call. Yeah, we can hold all questions until the end. I saw there were a few in the chat and it looks like you responded, but we can just keep all of the remaining ones to the end as well. But thank you both so much. Okay, moving forward, I would now like to introduce Arthur Hermann, who will be presenting the Introducing GenomeX, the foundational genomics domain housed within CodeX. Arthur has over 25 years of experience in enterprise-wide systems integration, healthcare information technology, IT consulting, and most recently, genomics and precision medicine strategies, data management, and technology. Arthur works at Kaiser Permanente, an integrated healthcare organization that provides all insurance, hospital, and healthcare services to over 12 million members across the United States. During his tenure at Kaiser, he has helped deploy the technology and governance of Kaiser's service-oriented architecture, SOA, was a member of the enterprise architecture team, and worked on strategy for lab technology and genetics in Kaiser's Northern California region. Arthur is currently a member of the Health IT Strategy and Policy team. And Arthur has also been a member of the HL7 FHIR Clinical Genomics Working Group for the last 4 years. Arthur, would you like me to drive the slides?
Please.
Great.
Thank you so much. Thank you for the introduction, and I'm very pleased to be here today. Good morning, good afternoon to all of you. I wanted to introduce GenomeX, and there's a little bit of a difference about GenomeX versus the other use cases that we've spoken about, which is that GenomeX is being developed as a foundational domain within CodeX. And by that, what we mean is genomics is not just, of course, it's very important in oncology, but it is important in many other areas of medicine and care. And so we're calling it a domain also because as opposed to one use case, this domain itself will have multiple use cases attached to it. So we'll be talking about that just a bit later. First, I'd like to go over why. Why do we actually need FHIR genomics and an accelerator? Currently, most genomic tests are sent from laboratories to healthcare organizations in the form of a PDF. I'm certain you all know that in today's world of electronic medical records and trying to use discrete data, that is not a very efficient way of getting that information. So as was stated, I've been a member of the HL7 Genomics Clinical Genomics Working Group for about 4 years. That group has been working a number of years even prior to that to develop the FHIR Genomics Implementation Guide, which contains all of the standard things you would see in an implementation guide for an entire work area in HL7. So the information model and all of the resources that are needed to actually message information regarding genomics. However, what we really need to do now with that, all of that work that's been done is accelerate the adoption of it, but do so by basically banging it against the wall and seeing what breaks and what it can stand up to real use. And so what we're really looking to do through the GenomeX Accelerator is to bring in a multi-stakeholder group to exercise the different parts of the implementation guide to ensure that it meets their needs and that that it works. And so, and once we have some of these strong pilots, hopefully they can be built in a way that they will scale. And that's our intention here. A common thread in all of the genomic use cases is the collection and use of data in a standardized machine-readable format. And that will allow data to be used in many ways for clinical care, for research, for building workflows within the EMR, et cetera. And as I said, this is a foundational domain. It won't be limited to oncology. use cases. Instead, it will support cancer use cases and any other appropriate use cases